Anorexia is a fear of fat that results in a restricted intake of calories. Bulimia involves a binging, consuming humongous quantities of calories in a very short period of time. That's called a binge. Even though the person may be full, they may continue to binge. I mean, I've heard of patients eating dozens and dozens of donuts during a binge, or a whole pie or 2 or 3 at a binge, or a whole huge amount of ice cream, or 5 or 6 or 12 hamburgers at one time, despite the fact that they're already full. But they'll binge, they'll just shovel food into their mouths in an effort to combat the anxiety, the disappointment, the frustration they're feeling in their lives at the time. Following the binge, there is often a purge. And the purge may be in the form of vomiting up the food that was just eaten. It may be in the form of excessive laxative abuse to try to get rid of the calories, or excessive exercise. You see exercise in terms of anorexics as well, but in bulimics, it's an effort to get rid of the excess calories they've just had. And once the binge is over, bulimics are generally beriddled with guilt, and the guilt makes them involve themselves often in these purging type behaviors. And then the binge starts all over again when the anxiety or the depression gets to a certain level. So bulimia involves binging and purging. Unlike anorexics, who are usually thin, bulimics are often not thin. They may be normal weight or overweight, and you may wonder, well, if they throw up, how can they be normal weight? And the reality is, when one consumes a large amount of food and then vomits, even though most of it goes out the mouth, some of it actually continues to be absorbed into the intestinal system, and these humongous amounts of calories may end up causing the person to actually gain weight, become overweight.